Good afternoon. This is Dr. Stephen Blake, and welcome to Lunch with the Doctor. This is obviously our first broadcast. I'm not sure if it's obvious, but it is. And so we want to invite those that are tuning in have an opportunity to present questions, and I'm going to do my best to figure out how to answer them for you with this technology. But this afternoon, we'll be talking about colon cancer. It's something that I talk about all the time, and I never get tired of talking about it. But particularly this first broadcast that we're doing today is to talk specifically about recommendations, signs and symptoms that we want to make sure everyone is aware of, that if they are occurring, that indicates that you should have your colon evaluated and not be led to believe that there's no reason to be concerned. Rectal bleeding is by far the most common complaint that would justify anybody seeking out a gastroenterologist to have an evaluation. Rectal bleeding, that's so important. But I want to talk about the recommendations as far as age categories are concerned. In February 2009, the American College of Gastroenterology made a sweeping recommendation modification as far as the age to initiate screenings for colon cancer, specifically for African Americans. And that recommendation modification basically stated that anyone of African descent should initiate having their colons evaluated at the age of 45. Now, the rationale for that was there were too many African Americans presenting at age 50 that already had colon cancer that was an advanced stage 3 or 4, and for the real possibility of a cure was pretty much gone at that point. So in order to save more lives, the American College of Gastroenterology made a recommendation that people of African descent should initiate their colon screens at the age of 45. It still stands that all non-African Americans can justifiably delay having their screenings until age 50, because statistics have not proven that a significant percentage of non-African Americans are having advanced colon cancer at the age of 50 with their first colonoscopy. So that's a very important point. Now, the modifications for initiating screenings occur when there's a recognized family history of colon cancer. Now, that family history recommendation is based on first-degree relatives, that meaning your mother, your father, your sister, your brother, or heaven forbid, your children develop colon cancer prior to you reaching the age of 45 and or 50, and that does occur. So if there's a family history in a first-degree relative, well, all surviving family members should have their colon evaluated starting 10 years prior to the age that that family member was diagnosed, less than the recommended age. Now, what I mean by that is, for example, if my father, who actually did die from colon cancer, but if he had died before the age of 45, let's say arbitrarily he was diagnosed and died at 40, well, that would mean that I should have my colon evaluated starting at the age of 30, 10 years prior to the age that he died from colon cancer. If my father, as he did, died from colon cancer after the age of 45, well, then all of his children and any surviving siblings that he might have that have not reached the age of 45, then we should all start having our colons evaluated at the age of 35, 10 years prior to the recommended age of 45, because he died after the age of 45. I'm going to repeat that one more time because that is a very important piece of information. If an individual was diagnosed and or died from colon cancer after the recommended age to start screening, well, all surviving family members will start having their colons evaluated 10 years prior to the recommended age. African Americans will be 35, 10 years prior to 45. Non-African Americans, it will be 40, 10 years prior to the age of 50. If that family member was diagnosed and or died from colon cancer less than the recommended age to initiate screening, example, African Americans, if the individual was diagnosed and died, say at 44, well then surviving family members, when waiting to 35, they would start at 34. And exponentially, it would change accordingly. For non-African Americans, if that individual was diagnosed and or died before the age of 50, all surviving family members will have their colon evaluated arbitrarily. If it was 49, well, instead of waiting for 40, they would start at 39, 10 years prior to 49, and it would change exponentially. 40, 30, 30, 20. That's very important. And that's why we need to make sure that we're educating all the family about what is happening health-wise so they can be aware of their family history and be informed to make the timely and proper decisions. Young millennials. Now, we are very interested in young millennials, and I'm talking specifically about the age of 20 to 34. There are too many young millennials that are being diagnosed and then die from colon cancer because at the time of diagnosis, it is such an advanced stage until it's pretty much hopeless. Now, there are no standard recommendations to make a decision about young millennials, but I want young millennials' parents and grandparents to know, and I want the young millennials themselves to know that you're pretty much out there by yourself unless you're well informed. Now, I'm going to share this one particular story before I go into talking about the signs and symptoms that young millennials and everybody in general needs to know, whether you are below the age of recommendation or you're at the age of recommendation and above the age of recommendation, and you still have not had your colon evaluated. That's what I'm talking to. Now, for the young millennials, a very common thing that often occurs that leads to problems and death as far as colon cancer is when a young millennial has seen blood per rectum, whether they are wiping themselves after a bowel movement or whether they are seeing blood on their stools when they look back to see what's in the commode, and we all should do that. You know, you can call it whatever you want to call it, but it's very important as far as your health is concerned is after every bowel movement, just take a look back there and see what you have put in the commode. We want to know if there's any blood there. We want to know if it's diarrhea and to what consistency of the amount. And we want to know the consistency of the stool, whether the diameter is the size of a pencil, more specifically, whether it's a small diameter, less concerned if it's a large diameter. And we want to know whether the stool is black. So we want to know the color of the stool. We want to know if we see any blood in the stool. We want to know if the stool is diarrhea, if it's all liquid or whether it's mixed liquid and solid, or whether it's all solid. And we want to know the diameter, whether it's a small caliber. Small caliber could be indicative of the fact that the lumen of the colon has been decreased because of a growth of a lesion. And that lesion, we're concerned to make sure it's not colon cancer. But if you're a young millennial or you're any age and you have not had your colonoscopy done and you're looking good and you're feeling good and you've seen blood, don't let anyone convince you that that blood has to be and only can be from the veins in the anal rectal area that has the name of hemorrhoids. Everybody has hemorrhoids. That's just the name of those veins. Just like we have veins in our hands, veins in our face, in our neck, and all of our body, well, the veins in the anal rectal area are just called hemorrhoids. So we all have them. So don't go around telling people, well, you know I have hemorrhoids. Well, we all have them. But if you see blood from your rectum, wiping yourself, or see blood in the commode when you have a bowel movement, get yourself evaluated to be assured that you know where that blood is coming from. There's about 10 possibilities that can explain why blood will be found on your tissue paper or seen in mixing your stool in the commode. Blood from a hemorrhoid vein is only one of those 10 things, and that's the least concerning thing. So don't let anybody, no disrespect to who you might have as a confidant, whether it's your family doctor, whoever, don't let anybody convince you if you see in blood that it has to be and it's only from your hemorrhoids. I had a friend of mine's son who died from colon cancer at the age of 31, married with a baby on the way, but he was being treated by his family doctor for hemorrhoids. And after several years, a year or two, I'm not sure exactly, but after an extended period of time, the young man began to lose weight during this course of treatment for his hemorrhoids, and the bleeding got worse. And he went to his family doctor and explained to him, "Doc, no disrespect to you, but these hemorrhoids will not stop bleeding." The family doctor got a little alarmed, rightly so. He should have been alarmed the very first time the young man presented and said that he had blood from his rectum. But nevertheless, he finally got concerned and suggested that the young man have a colonoscopy. Well, it was too late. It was well beyond too late. And he left a wife expecting to become a mother. So if you're seeing blood, whether you come to me, wherever in the world you might be, listening to this live conversation, have yourself evaluated. Now, the next thing is black bowel movements. If you see black bowel movements, always look at the tissue when you wipe yourself. There's nothing freaky or dysfunctional about that. That's part of health. It's important to know. That's why we do rectal exams, because we want to know. We want to get a little bit of your specimen of your stool and take a look at it and put it on a special card to put special developer on it so we can see what we call O-cup blood that's not visible with the naked eye, but only seen when the special chemical is placed there. So, and we want to, when we do the rectal exam, it gives us an opportunity. You might have heard of Farrah Fawcett Major. She died of anal cancer. If she had only had a thorough rectal exam, the lady would probably still be here. So don't frown away from a rectal exam, because it's one of the most important part of anybody's annual physical. But look at the tissue when you wipe yourself. Look at the stool in the commode, because you want to know if it's black or not. Not dark green or not dark brown, but I mean literally black. That's an indication that you need to have a thorough evaluation, not just limited to the colonoscopy, but you need to have an upper endoscopy. That affords us the opportunity to look at your esophagus and your stomach proper, and the proximal part of the small intestine, the duodenum. So stool gazing is extremely important. Now, a couple other things, it talks about the function of your bowel movements. Sometimes when you're growing a polyp or you're developing a cancer, the polyp has progressed to cancer, constipation can occur. If and when that occurs, and it's something that you don't normally have a problem with, well, then that's a red flag that you need to have yourself evaluated. Diarrhea. If it's not something that you routinely have had a problem with, and you're having it now, you need to be evaluated. If you're having diarrhea, then sometimes constipation back and forth between the two, and you have not been evaluated, you need to be evaluated. Then if you're having unusual abdominal pains, you know your body, you know that you have certain types of pains, and it was never revealed to be anything, or if you've been having pains and you never had it evaluated to be assured that it's nothing, you need to be evaluated. Sometimes that might be the only thing that colon cancer will cause is a continuous slight or sometimes intermittent periodically occurring abdominal pain. If you're experiencing that, no matter what age you are, but specifically I'm talking to young millennials and the parents and the grandparents of young millennials, get yourself evaluated. My name is Dr. J. Stephen Blake. I'm not sure if I mentioned that when I first started the show, because this is my first time, and I'm expecting to get a little bit more savvy as we move forward. This is one of the best things that could possibly be occurring, to have an opportunity to reach people in a manner that routinely has never been done before. Gastroenterology is probably one of the most important systems of our whole body. Without it, we don't exist. We know that colon cancer is preventable. It's the second leading cause of cancer death. We're reaching out to whoever is interested in being educated, because our whole purpose is to contribute to saving lives from an untimely and an unnecessary death of a colon cancer that is preventable. We can't say that for breast. We can't say it for lungs, which is the #1 killer. We can't say it for prostate. We can't say it for any other cancer in the body. But we can say that with confidence for colon cancer. My name is Dr. J. Stephen Blake. I'm a board-certified gastroenterologist. I have a private practice in Philadelphia, Pennsylvania. And at our private practice, we have a licensed and certified ambulatory endoscopy surgery center. It's like a small hospital. At some point, we're even give a tour of that on this lunchbox conversation moving forward. But call somebody. In Philadelphia, you can call us at 215-849-4902. You can follow us on Facebook. You can follow us on Instagram and Twitter. And there are things that will be posted on Facebook, all in a concerted effort to educate the community. We want to be a part of this fight as far as colon cancer is concerned. The number of people that die every year, which is well over 60,000, not counting the number that get diagnosed every year, but we're talking about the ones that die from it every year. There's no reason for that. So that's why we're doing what we're doing. We're located at 6827 Germantown Avenue in Philadelphia, Pennsylvania. You can check us out on our website at www.jsblake.com. Young millennials, I want to reiterate, I'm talking to your grandparents, I'm talking to your parents, and I'm talking to you. And I'm sure there are people out there who are listening to me know somebody who needs to have their colon evaluated. Rectal bleeding, black bowel movement, abdominal pain, constipation, diarrhea. And heaven forbid, if you reach the point where you're having weight loss without any effort whatsoever, you need to be completely evaluated to make sure that you don't have specifically colon cancer, which is 100% preventable. I'm going to reiterate those recommendations as far as ages are concerned. African Americans, it's age 45. Start your colonoscopy. We all should have checked every 5 years some kind of way. Don't let anybody convince you that every 10 years is adequate. Just think about it. Do you know anybody that can tell you what will happen to your body tomorrow physically? So why do you think someone has the ability to be able to tell you that you will have nothing occur in your body as far as colon polyps and or cancer is concerned in 10 years? Just to make sure people know, I lost my father to colon cancer. He had his colonoscopy. But he was convinced that 10 years was okay with him to wait for the next colonoscopy because he didn't want to have it in the first place. Well, he died in the 9th year. Those are realities. I just had a gentleman last week that had his colonoscopy 6 years ago. He didn't come back in 5 years. I took out 6 polyps. 6 years ago, he had no polyps. And 3 of the polyps that I removed just last week were of significant size. Nobody can tell you what will happen inside your body. Every 5 years, the rationale for that is that if I perform a colonoscopy today on you, and I find no polyps, well, in 5 years, say if a polyp starts growing the very next day after your colonoscopy, well, in 5 years, we anticipate if that polyp stops growing the very next day after your colonoscopy, in your 5-year follow-up, it still should be just at the stage of a polyp. Or at the worst, or the most, a very early colon cancer that will be curable by surgery without having to intervene beyond that. Get it fixated in your mind that every 5 years, I'm going to have my colon evaluated. Now that brings me to this. There are a lot of people that I have diagnosed colon cancer in that were well into their late 60s, well into their early or late 70s, and I dare say in their 80s. having their colonoscopies for the very first time. And every time I asked those individuals that I diagnosed colon cancer in that were having their colonoscopy for the first time, why would you wait until you're 75 to come in for your first colonoscopy? It never failed. The answer was always, I didn't say sometime or most of the time, but it was always that prep. I tried it and it was too much for me to get down, or I tried it and I was never able to get clean enough because I couldn't keep enough down because I was always bringing it up. Or I heard about how horrible it was. I made the decision I don't need to do it anyway because I look good and I feel good. So I don't think I need it anyway. So I'm not going to even try that prep. And then I would say to them, well, now, you said you never could get it down, or you made the decision, that after several tries of not being completely clean, not to go back, but this time you're clean and you got it all down. Why? The answer was not some of the time or most of the time, but always the same thing. Well, something was wrong, and I wanted to make sure that I was okay. And then I would have to say to them, well, then I want you to know that you're not okay. You have colon cancer. The PrEP is a major deterrent, a direct causation for people to develop colon cancer, the PrEP. So here at Blake GI Associates, what we have done, we have developed a technique we call the colon hydrocleanse, where we do a colonoscopy without the PrEP. I can't see to make sure that you see this, but this is showing that at Blake GI Associates, we want you to give us a call, because if you don't want to drink the PrEP, we have the ability to clean your colon out without you drinking the PrEP. It's called a colon hydrocleanse. You make an appointment, you come in about an hour before your scheduled colonoscopy. We have what we call our colon hydrocleanse spas. It takes our GI technicians about 35 to 45 minutes to clean you out. Then after that is completed, you're brought into the surgery center. My nurses receive you and prepare you for your procedure. Then you're brought into the procedure room, and I'm waiting there to encounter you, and we perform your colonoscopy under sedation with my nurse anesthetist. And by the time you're finished, you feel like you've been to the spa. We have eliminated the drama from having to drink the PrEP. So give us a call, 215-849-4902. And if you don't live in Philadelphia or the metro Philadelphia area, when you're visiting Philadelphia, since you don't have to drink the PrEP, make an appointment, have your procedure, and go about your way while you're visiting Philadelphia. My name is Dr. J. Stephen Blake. I'm a board-certified gastroenterologist. Our practice is Blake Gastroenterology Associates. We own Mount Airy Ambulatory Endoscopy Surgery Center. We offer the only alternative to having a colonoscopy by avoiding drinking the PrEP. It's called the colon hydrocleanse. We're located at 6827 Germantown Avenue, Philadelphia, PA. Give us a call. Follow us on Facebook and Twitter and Instagram. And check us out on the web at www.jsblake.com. Trust and believe. It's been a pleasure.